Hello everyone and welcome to the first CB clips of the new year. In these CB clips, I presented you with a left-sided thoracic mass that was prenatally diagnosed, and at imaging, almost all of you correctly diagnosed it as an extralobar pulmonary sequestration. Now, what are the options for treatment of a pulmonary sequestration? Well, we can observe, we can embolize if there's a hemodynamic issue like high output heart failure, we can excise by thoracoscopy, or we can excise by thoracotomy. But let's step back for a minute and ask ourselves, why do we remove asymptomatic lung lesions? Well, we're concerned about infection. We're concerned about malignancy, either being confused with PPB or potentially a very small risk of latent malignancy. And we think that if we remove space-occupying, non-functional lung, we may actually promote normal lung development in a child. However, if you look at this critically, none of these really apply to extralobar sequestrations. They don't tend to get infected because they do not communicate with the airway. There's hardly any reports of malignant degeneration of an extralobar pulmonary sequestration, and they really do not exert any significant space-occupying effect. So the clinical principle is an asymptomatic extralobar pulmonary sequestration, very different from intralobar, tends to stay asymptomatic. And in fact, you don't really need to continue to image these if you decide to observe. So if you look at the literature, we really mostly resect them because they are there. And I do not believe this is a good indication to resect an asymptomatic lesion. As Dr. Siggy Ayn, one of our mentors here in Canada, used to say, you cannot improve on an asymptomatic patient. Given this, I think this is an excellent chance for shared decision-making, as some of you pointed out. And in fact, in this case, I discussed this very clearly with the parents. They strongly favored the resection. And in fact, by thoracoscopy, I resected it and repaired the focal diaphragmatic eventration. And you can see that in the video. Again, observe extralobar pulmonary sequestrations. It is safe to do so. Thank you, and until the next CB clips, Happy New Year to all of you.